We're taught that our health exists in GP surgeries and hospital rooms. But what if I told you that something as simple as creativity could help extend your life? Creativity is not just a way for us to be more playful, happy, and socially connected. It can prevent the decline of your physical health and even extend your life. Now, I know what you're thinking. If all that was true, if things like gardening, cooking, painting, and singing were really so powerful, then why are our health stories dominated by waiting lists for clinical services, images of ambulances being used as beds in winter, or even the headlines about our aging population and the decline of the NHS? We've been taught that clinical services are the answer to our health and well-being. And don't get me wrong, we are incredibly lucky to be able to access these, whether it be medication, surgery, or other scientific advancements. And what's more, in the UK, we have these free at the point of access. But clinical services only account for up to 20% of our overall health and well-being. The rest is decided by the food we eat or our access to clean water. It's about whether we have shelter, whether we have access to warmth. It's about the education we experience and the workplace conditions we work in. It's about our health behaviors, whether we engage in exercise and access nature. And it's about our stress, our sense of safety, our sense of purpose. In other words, health is about the way we live our lives, not just the way that we are treated. My idea worth sharing with you today is that since health is about the way we live our lives, creativity can be seen as a tool in our healthcare toolkit. As a research and policymaker, I have access to the evidence about creative health, and I believe that this tool is not just something that is underutilized, it's also something that is vastly underestimated. Let me explain by telling you a story. This story is about Susan. She's a retired woman who loves lemon meringue pie and the Antiques Roadshow. Susan has a fantastic sense of humor, and she lives with a Cocker Spaniel named Daniel. Now, Susan had a fall a couple of years ago, and she ended up in A&E to treat her injuries. Susan was really shook up by this experience. It made her feel scared to move around and even to leave the house alone. Her world started to get smaller. She started to feel lonely and like she was fragile. Unfortunately, Susan is not the only person who experiences this. 30% of adults aged 65 or older in the UK experience a fall every year. 1 in 10 of these adults become scared to leave the house alone. Another 1 in 10 die within a year of that fall. Now, luckily for Susan, she gained access to a dance program designed for people with frailty that have had a fall. Now, for her, this was an uphill battle getting through those doors. She thought, how am I going to dance when I can't even walk? But luckily for her, she did. She didn't want to live that life anymore, and this program was available to support her. This program expertly incorporates physiotherapy exercises into dance programs. It means that it strengthens the people that are involved and improves their stability, which means that their chance of falling drops by 58%. The people who go to these services don't just experience these physical health benefits. They also have an improvement in their confidence, their well-being, and they often make friends along the way. Now, Susan's story is not unique. Dance is a great way of improving your health and well-being in a multitude of ways. Now, I'm going to pull out my little post-it note for the stats so I don't get them wrong. If you dance, you are 46% less likely to die of a cardiovascular death than if somebody who doesn't dance. Every year, £149 million is saved by how dance prevents the onset of dementia. Another 157 million is saved by how it prevents type 2 diabetes. It also supports Parkinson's, chronic pain, blood pressure, and so much more. And that's just dance. Things like singing also improve our health. For example, people with COPD or asthma who receive a referral to a Singing for Lung Health service see themselves 6 months after that referral having 23% less A&E admissions and 21% less doctor's appointments. For people who see art in hospital, you not only recover faster, but you also experience less pain along the way. Even everyday cultural engagement can improve our health and well-being, such as things like reducing your risk of getting depression. The list really does go on. And that's why at the National Centre for Creative Health, they have spent years advocating for the benefits of health and creativity when combined together. They advocate for this to senior healthcare leaders and policymakers across the UK, helping us to change our healthcare system. But along this advocacy journey, we've forgotten to engage the people who matter most, the people who experience the benefits of these services, and that's people like you. Everyone in the room here today, everyone watching online. Without you, the culture of healthcare cannot change. We'll continue to rely on clinical services even when the arts have been proven to have greater benefits on that particular condition. And the great thing about creativity and engaging it for your own sake, your own lives, is that it reduces pressures on those same medical services that we all use. So creativity here is not there to replace clinical services. It is a tool in our toolbox. It's something we can take into our lives and have power over to increase our health and well-being. But of course, there is one key barrier getting in the way of this. Lots of us are told that creativity does not belong to us. We say things like, I don't know how to dance, I'm not very good at singing. Art is for artists, not for people like me. When we were young, creativity came intuitively to us. It wasn't something that we felt we had to be good at. It wasn't something that we felt had to be seen or make sense. It just had to exist. It was intuitive to our lives. I invite you to think today about how creativity might appear as a tool within your toolbox. You have the power to decide how that appears in your life, what makes you flourish. It could be the awe of engaging in imagination. It could be the flow states you go into, which reduces your stress. Maybe it's the laughter you get by creating with others, or the passion you feel when you create with purpose. Or maybe it's the power you feel when you prevent an illness that never even appeared in your life. So today I'm going to leave you with one question. If creativity is the tool that you've been underutilizing in your healthcare toolkit, what will be your creative way of staying alive? Thank you.